Living heart valves could revolutionize how we treat numerous pediatric heart valve disorders, offering new hope for children and their families. But here's where it gets truly fascinating and a bit controversial. This innovative procedure might reduce the need for lifelong use of powerful medications. Could this be a game changer in pediatric cardiac care? A groundbreaking study led by pediatric heart experts at Duke Health has revealed promising outcomes using living heart valves harvested through a procedure known as partial heart transplantation. Instead of transplanting an entire donor heart, surgeons transplant only the valve portion, preserving living tissue that can adapt and grow with the child's heart over time. Published in the Journal of the American Medical Association, the study tracked 19 children suffering from various congenital heart defects. These young patients, ranging from newborns to teenagers, benefited from receiving living valves tailored to their specific heart conditions, such as truncus arteriosus and Tetralogy of Fallot. The procedure's innovative twist is that these valves don't just function initially. They continue to grow alongside the children's development, something traditional mechanical or artificial valves can't do. Joseph Turek, the study's corresponding author and chief of pediatric cardiac surgery at Duke Health, emphasized the versatility of this method. Partial heart transplantation isn't a one-off fix. It's a flexible solution capable of addressing a broad spectrum of heart problems in kids. One of the most remarkable advantages, Turek points out, is that these new valves demand less immunosuppressive medication compared to full heart transplants, significantly easing the treatment burden on young patients and their families. Researchers closely monitored valve performance with ultrasound technology and found consistently healthy function without a single case of valve failure requiring reoperation. This level of durability is impressive considering the patient's diverse diagnoses and ages. A particularly eye-opening instance involved a child who, due to a separate infection, had to discontinue anti-rejection drugs entirely. Yet, the valve continued to grow and work perfectly, a finding that hints at the potential for reducing or potentially eliminating lifelong immunosuppression for some patients. Douglas Overbey, assistant professor of surgery and co-author of the study, highlighted the significance of this observation. If some children can avoid long-term immunosuppressive therapy, we could spare them from numerous side effects that often come with these medications. Since such medications can pose serious health risks over time, this possibility could represent a major leap forward in pediatric cardiac treatment. While partial heart transplantation remains an emerging therapy with much to learn about its long-term success, the early results are undeniably encouraging. The research receives support from the Brett Boyer Foundation and the Graham McDaniel Foundation, both of which funded essential preclinical studies. But this raises some intriguing questions. Should the medical community start favoring this approach over traditional valves despite the limited long-term data? Could reducing immunosuppressive drugs create risks we haven't yet fully grasped? These are debates well worth having, and your thoughts are welcome. Do you think living heart valves could be the future of pediatric heart care? Or should we wait for more evidence? Share your views below.